I want to welcome, we have 23 participants and our panel online. This is BPF's first webinar, and I welcome all the participants, and I thank you for taking the time to come online. May I suggest because of the pandemic and so many people have lost their lives and so many people are sick, maybe we just a 30-second silence and a small prayer for those who have lost people or those who are not well, starting now. Thank you. I am the chairman of the British Pakistan Foundation, and as I said, this is British Pakistan Foundation's first webinar. We're very proud to have three very prominent doctors from within the community to join us. So thank you, panel. And I will introduce all three of them. The first one is Samia Latif, Dr. Samia Latif, who is a consultant public health practitioner. And she will, the three people will come on board just in a minute, and they will give a small background on who they are. The second doctor is Dr. Iqbal, who's a general practitioner with a vast amount of experience and very much on the front line of this pandemic. And finally, we have Dr. Shahid Latif, who is a consultant psychiatrist and a very well experienced and has a lot of knowledge on mental health. So before we start, if those of you who are online, I'm sure you already know about BPF. If you don't, please visit our website and you can learn everything about us. We're a platform for first generation, second generation, and third generation Pakistanis who either immigrated to Britain and the UK or who live here. May I ask Samia Latif, Dr. Samia Latif, to start off with the introduction of herself.
Assalamu alaikum and good evening, everyone. So my name is Dr. Samia Latif. I'm a public health consultant and I work for Public Health England. However, all the views and opinions I express today are mine as a professional and not those of my organization. I'm also the academic registrar for the Faculty of Public Health, and I'm also the chair for the BAME network across Public Health England. And at the moment, we're extremely busy trying to provide an adequate response to the challenges given to us by coronavirus, and we'll be talking about that.
Thank you, Dr. Latif. Can I ask Dr. Tia Iqbal to give a little bit of background on herself?
Hello, hi, thank you, and good evening, everybody. I'm a general practitioner. I have been for about 20 years now. I work in Oxfordshire, although I have worked all over the country, so I have a pretty good idea of how the NHS works across England. We've been at the front line for the pandemic virus, and it's been a couple of months now that life as we know it has just changed completely upside down. So what the rest of the world is feeling, we're feeling too, and there are a lot of anxieties, and I hope that we can answer some of the questions that you have today. Thanks.
Thank you, Dr. Iqbal. And now I will come to Dr. Shahid Latif. Shahid, can you give us a little background on yourself?
Thank you. Assalamu alaikum and good evening, everybody. I'm Dr. Shahid Latif. I'm a consultant psychiatrist and clinical director working in the NHS. I've been a consultant for over 13 years and have been practicing as a psychiatrist. I started off my psychiatric career about 22 years ago. I'm also the chair for for the Royal College of Psychiatrists Transcultural Special Interest Group, which actually means that one of my areas of expertise is culture and mental health within the BAME community, etc. Like Dr. Iqbal and Dr. Samia Latif have said, mentioned that this unprecedented the impact of this virus has had an impact not only the physical element of our well-being, but also on the mental aspect. And this is something that is very, very important, very topical. And I thank BPF for bringing this up and giving an opportunity for this to go out to the community at large.
Thank you, Dr. Latif. So we will first of all, thank you all for several people have sent in several questions and we've got them all listed. So we will start off with Dr. Dr. Samia Latif. And my first question to you, doctor, is that how does this virus spread?
Right. So basically, this is it's a new virus. It's a novel virus, and it's the first time that this particular strain of the virus has crossed over from animals to humans. So we're still learning about it. But what we do know is that it spreads in through droplets. So when a person speaks or coughs or sneezes, the droplets may land on someone else or on some surfaces where it may exist for a while. And when you touch those hard surfaces, you could accidentally sort of touch your mouth or your nose or your eyes, and that's how the virus can actually enter your body. So it spreads by droplet infection, but it only spreads if you come in contact with someone who is sneezing in front of you, coughing in front of you, and has not sort of covered their mouth or talking, and in the droplets, in the moisture of those droplets, that's how the virus spreads. Or it lands on hard surfaces and you can end up touching those surfaces.
Thank you for that. And what actually is the coronavirus, doctor?
Right, so there's a few things you can do to prevent it, and I think the basic thing here is hygiene, and there's a couple of different types of hygiene. So we talk about hand hygiene and respiratory hygiene and general hygiene. So I'll go through all three in a very simple sort of way. So hand hygiene means you need to wash your hands with warm water and soap for about 20 seconds, and it has to be a good thorough wash up, you know, including your wrists. Washing your hands will prevent the virus infecting you, washing your hands properly. So whenever you come home from outside, you've been to the bathroom, you're about to do some work in the kitchen, after you prepared food, just wash your hands. After you've handled objects that have come from outside, wash your hands with warm water and soap. And I must say here that yes, sanitizers help as well, but nothing is as good as warm water and soap. And sanitizers are for those situations where you don't have access to water and soap. You're in the car or you're in a hospital, and you know, so warm water and soap is the most essential. That's hand hygiene. Now, respiratory hygiene, as we call it, is if you cough or sneeze, keep a tissue with you and try and catch your cough and sneeze in the tissue, and then make sure you dispose of that tissue in a bin straight away, and then wash your hands afterwards. And you would have seen it, you would have seen the Catch It, Bin It campaign that we normally run every year for colds and flus. So respiratory hygiene is making sure that you're not just coughing and sneezing into the open air, you've got some tissue, you're catching it, and you're disposing of that tissue and washing your hands. And the last element is just general hygiene around the house. So try and disinfect all your hard surfaces, your kitchen tops, door handles. I keep telling my kids, please just clean your mobiles. I think we handle our mobile phones so many times, the most frequently touched objects, and we don't think of cleaning them. Sort of wipe your TV mobile, your TV remote controls, and switches and stuff like that. Things that you frequently touch, try and wipe them with a disinfectant or a disinfectant wipe or a piece of cloth dipped in a disinfectant solution. So just up the hygiene, and these three things are really, really good things that you can do yourself, and that's what we're advising people to do at home.
Thank you, Dr. Latif. Now, what are the preventative measures that one can take?
Right. So I've already spoken about the hygiene measures that you can take. But as many people are aware, the government has asked us to maintain social distancing and to isolate ourselves if we have symptoms. And I'm sure Dr. Iqbal will talk a bit more about that. So the physical distancing means that if you do come in contact with someone, you should be at least 2 meters away from them, because the droplet that I spoke about can only travel up to about 1 meter and then it drops to the ground. So keep that 2 meters or more distance between yourself and another person if you come in contact with them. You would have heard the phrase being used about social isolation or social distancing. I prefer the term physical distancing, because there's no reason you need to socially isolate yourself. Nowadays, we're so fortunate. We've got media that we can use. We can pick up the phone, we can use WhatsApp, we can FaceTime, we can Skype, we can Zoom as we're doing now. So there's so many ways that you can stay in touch with your family, your friends, and your loved ones. So you don't really need to be socially isolated from them, but you must maintain that physical distance. So that is one thing. Now, the other thing is we are currently in a state of quarantine in the country, or lockdown, which means please stay at home. Only go out for essential travel. And what is essential? If you have to go to work, if you're a frontline worker and your work demands that you go to work, if you need to do your daily groceries, essential groceries, and you can go out once a day for some form of physical exercise, or if you're ill and you're going to the hospital. But even that, Dr. Iqbal will sort of talk us through how we manage illnesses at this time. So I think the key message that we'd like to give everyone is, please stay home. Don't take this lightly. We have seen so many loved ones pass away, loved ones in hospital. Fortunately, it is a mild infection. So 80% of the people will recover, 80% or more do recover, and it is a mild infection for them. However, for the people who have low immunity, or who are elderly, or who are pregnant and have other illnesses, they're not so lucky, and we really need to protect them. So please stay at home and observe that physical distancing and that isolation that we've been asked to observe.
Okay, and finally, Dr. Samia, as you know, the month of Ramadan is coming, and one of the questions was, what are the religious and social aspects to consider?
Right. I think I'd really like to stress here. I live in Leicester. I live in a community where there's lots of Muslims, lots of Asians, and Muslims from other ethnic backgrounds as well. And one thing that really bothers me is when I hear people say, oh, we have faith in Allah and Allah is going to protect us. So, all of this, it doesn't bother us, and they just go out and they think they're protected. Yes, Allah does protect you, and it's good to have faith in Allah. But at the same time, we all know the story about the Bedouin who was walking in somewhere, got off his camel and didn't tie his camel. And when the Prophet, peace be upon him, asked him, why did you leave your camel untied? And he said, oh, because I have faith in Allah. And the Prophet, peace be upon him, said, yes, have faith in Allah, but tie your camel. You need to take action. So I tell all my colleagues and my social acquaintances that, look, I call it faith with action. So you should have faith, but you need to take some action. You need to follow the guidelines the government has given us. What we've just spoken about. You need to observe all of that. So I think that's one key message. The other key message is, we know from Islamic history that at the time of the companions of the Prophet Muhammad, peace be upon him, they encountered a plague. It was thought to be a bubonic plague. So they encountered a plague. It was called the plague of Amwas. It was in the area of Palestine during the Khilafat of Hazrat Umar. And at that time, people remember that the Prophet had said, if a plague or an infectious disease or a pandemic like what we are experiencing now affects you, those people in a town or a neighborhood or a community should stay there. They shouldn't leave that town, and no one should enter that town. In very, very simple terms, that is what quarantine is. So please, we have precedent of it in our Islamic history. So when people say they want to go to the mosques, I know Ramadan is around the corner. We may not be having the congregational Taraweeh prayers. We know we're not having our Jummah prayers in the mosque. We have permission in our religion, because the health and safety of mankind is very important and more important. So we have precedence of this, and you can stay at home and observe all your religious duties at home. So I'd really like to stress people. I've heard people saying, oh, we're going to be getting together with family and friends to do our Taraweehs. Please don't do that. Protect yourself, and more importantly, protect others who may have very poor immunity. I'll leave the Ramadan and the diabetic bit and the medical bits for Dr. Iqbal to answer, but this is just what I wanted to highlight from a religious aspect.
Okay, Samia, thank you very much for that introduction to this specific part of our discussion, which was to do with the religious and social aspects. And yes, I have one or two other questions which we reserve for Dr. Iqbal. Would you like to say a final word to all our participants as to any, and I know that there are lots of words of warning, but one final statement from you would really do good.
I would say, don't take this lightly. Please observe the social distancing, isolation that you've been asked to observe. Wash your hands with soap and warm water, and use a tissue when you cough or sneeze. Stay safe and keep others safe.
Thank you, Dr. Samia. I really appreciate you giving us this background, and I will now move to Dr. Iqbal, who has taken the time out to join us. As we said, she's a consultant, or she's a GP who's been in the front line. And Dr. Iqbal, would you like to start off with just giving a general statement about the coronavirus?
Yes, certainly. I mean, Dr. Latif knows it more from a kind of public health perspective, but it is a disease that's kind of taken the world by surprise and keeps changing. Now, for most of us, as Dr. Latif said, this is a nuisance illness. We will be very ill, we'll be miserable, but we will come out the other end. So 80% of us will have the mild form of the disease. And in fact, some will have no symptoms at all. But some people can become very seriously ill with it. And the initial symptoms tend to be fever, a cough. Some people will get muscle pains. They may get chest pain or just generalized muscle pains. Some people have a headache. They may have loss of taste and smell. And that was something that doctors observed early on in the illness, and that's not been seen in other flu-like illnesses like this, but you will completely lose your sense of taste or smell. So when someone tells me that, I do worry that they have coronavirus. Other symptoms are coming to light as well. For example, in the last sort of week, 10 days, we've been hearing reports of people getting chilblains. So when you get red, painful toes, that seems to be an indicator of coronavirus as well. And again, that's just coming to light now. The symptoms tend to last for a week in most people. So towards the end of that time, they start to pick up. Now, we worry more about the ones who are still unwell in the second week. And you can get unwell in the second week, you can get unwell in the third week as well. So it can last, we're beginning to find that it's lasting longer in some people. And the main thing is that the breathlessness is the symptom that we worry about. When people feel short of breath, they have chest pain, and they struggle to do the things that they normally would do. But again, I want to stress that that is in the minority. What we suggest that you do if you feel that you have symptoms of coronavirus is to contact 111. You don't contact your GP, and please don't go to A&E because that's the wrong place for it, but you contact 111, and they're the people there are trained to ask you the questions, make an assessment. They may decide on the basis of that assessment that you should see your GP, and in which case we will see you. they may decide that you go to a special hot hub, and those are places where everyone is kitted out to see people with coronavirus, so they have all the safety equipment, or they may indeed feel that you need to go to hospital. Dr. Latif touched on what can make coronavirus more worrying for certain individuals, and it certainly is coexisting health conditions. Age is a factor, so over 60, which doesn't sound that old, not to me anymore, but things like diabetes are a cause for increased anxiety when someone has coronavirus, because it increases your susceptibility to it. You're more likely to have a severe illness. High blood pressure is a factor. Coronary disease is a factor. Respiratory conditions, so we worry about people who may have asthma, who may have COPD, and having a high BMI, so being obese, is also known to be a risk factor. And in terms of treatment, well, there isn't much that you can do. We do initially give people a course of antibiotics if we feel that there may be some secondary bacterial infection, but it's generally rest, and it's taking care of yourself. Paracetamol. You can also now take ibuprofen, we've been told, although we were worried that you might not be safe, but it is safe. So you can take paracetamol to try and reduce your temperature, and make sure you have a good fluid intake. Those seem to be the key things. But also, I would stress that if you have concerns, contact 111, get advice. Don't just sit at home, and don't, you need to seek help if you're worried about your health.
So Tia, just going on from what we were getting from Dr. Latif, can I ask you to expand a little bit more on, Ramadan coming up and the religious aspect, and it's things like immunity for some people who, and a lot of us do fast, and for those especially who are fasting, if we're weak, should we be doing it? Shouldn't we be doing it? Could you give a little bit of explanation on that?
I think it's very much an issue for the individual and how they feel. Now, if you can't fast through illness, you can always make up your fasts another time. And with other conditions, so people have been dealing with Ramadan and their illnesses for a long time. So most people know that there are drugs that you can take, medicines that you can take at the beginning of your fast and as you break your fast. So that probably wouldn't change, but I would caution that if somebody had symptoms of coronavirus, I would, as a doctor, my advice would them to be probably not to fast and to make up the fasting another time. The main concern is that we need to make sure that they keep up their fluid intake and don't become dehydrated. So for that reason, I would prefer that they did not fast, but it is a decision for the individual.
Is there anything, Dr. Iqbal, that people should be having more of during the month of Ramadan? Whether they should be having more vegetables or whatever. I mean, is there anything like that you could assist or advise us on?
That's an interesting question. I think I always feel that people should be having more vegetables. So yes to that. But we don't know enough about the coronavirus, and I'm sure that if you have plenty of fruit and vegetables, you are bolstering your immune system, so that's got to be a good thing. But other than that, I have no specific advice.
Okay, Dr. Iqbal, so is there a last word you want to tell all our participants, how they should be behaving during this pandemic? I mean, Dr. Latif has already given us her views. Would you like to have a last word on this?
Yes, I would. Thank you. The only one thing I want to stress is that if someone in your household has symptoms of coronavirus, then that person, so the individual who's affected, should isolate for 7 days. They shouldn't go out for 7 days. And household contacts, so that's everybody else in the family, should isolate for 14 days. Now that's important so that the infection doesn't spread outside of that household. And that's the main thing to remember, that if we're going to contain this infection, we're going to stop the spread of it, that people do, if they're infected, they stay home, and those that are in the household stay home also.
I really appreciate your input, and I hope the participants have gained knowledge. I'm going to now go to Dr. Shahid Latif, who, as we know, is a consultant psychiatrist and is got specialty in mental health, and we've been saving a couple of questions for him. Which so, Shahid, can I ask you to just give a slight introduction and then take it from there?
Yes, thank you, Asif. Like I said, I'm a consultant psychiatrist. Been working as a consultant for over 13 years, and been training in psychiatry. Well, trained for 22 years. So my areas of special interest is culture and mental health. So one of the things that I've been really working with is what kind of cultural impacts there may be for individuals to develop what we call mental disorders or mental illness or mental distress, which is not necessarily an illness. So that's my general introduction.
Right. My first question to you, Dr. Saab, is that what is the what are the mental health aspects of this condition?
Okay, very good question. I think one of the first things that we need to establish is the fact that this whole unprecedented situation is something which is very new to all of us. I'm not going to say many of us or some of us. I'm going to say all of us. Be us healthcare professionals, be us general population. Well, it's new to us. It's a scenario where all of us are going to experience some form of psychological impact on us, and I'm aware that this is not just in the general population. It's also within the healthcare services as well as is being experienced. And the reason for that is because everything has changed. It's only been last 4 or 5 weeks, 3 or 4 weeks, etc. Things have changed dramatically. And what this has actually offered, or what actually has happened, is that everybody's life has been thrown upside down. Work-life balance has been disturbed. People have been asked to, as Dr. Samia Latif said earlier on, to physically distance themselves, socially distance themselves, which is obviously can be mistaken as that we need to completely isolate ourselves, which isn't the case. It should be physical distancing with social connectivity, which is much more important at this stage. So the impact that this may have, as I said earlier on, is those who have pre-existing mental health problems, be it a mental disorder or a mental illness, we are experiencing an upsurge of symptoms, not necessarily being admitted into a hospital, but I am aware from my colleagues, and we've experienced in the outpatient clinics that although we're not doing face-to-face for obvious reasons, unless we really, really have to, we are doing more phone consultations and video consultations, and that there has been a surge of referrals, and there's been a surge of individuals who, where their pre-existing mental health conditions are coming more to the fore, and they're getting more anxious, more dysphoric, etc. But it's not just the individuals who have pre-existing mental health problems. It's those who have never experienced mental health difficulties, or may have experienced mental health difficulties in the past and have been functioning reasonably well into their day-to-day structure. And for many people, the unknown is what has happened, what is going to happen, and a lot of people are asking, and I'm sure there's going to be a lot of questions in relation to what next. So that what next causes a lot of anxiety, a lot of distress and dysphoria for individuals. And it's those things going forward, currently and going forward, which we need to be very conscious of. We as healthcare professionals need to be conscious of ourselves and others, that is our patient groups and the general population. And the general population needs to be aware how to equip themselves with coping mechanisms of how to manage and deal with the unknown, which is before us.
Okay, thank you for that, Dr. Saab. And a very important question, just leading on from everything you told us. What are the treatments available? So, if you feel that there is issues at home, and maybe in some instances, people are not even diagnosed with any mental health issues, but due to the circumstances over the last 6 weeks, people might have developed. So what are these treatments available? Where do people go for treatments, or who do they contact?
Okay, so very good question, Asif. There is different strands to that, and the first strand is obviously if we've got individuals with previously diagnosis of any mental disorder or illness, or those who were more stable and are now experiencing, obviously I would advise them to communicate and contact their mental health services, as we call the community mental health team, to explain as to how they're feeling. For the general population, and even for those with pre-existing, what we are urging, and what's coming through from all NHS mental health trusts, from the Royal College of Psychiatry, is very basic guidelines. And those basic guidelines are part of, number one, a preventative measure, but also that if you are experiencing any distress or anxiety, to follow those guidelines in order to reduce that stress. One of the basic things which individuals can do, which is really, really important, is to make sure that they maintain a structure to the day. That's really important. Individuals shouldn't be waking up and with the sense in their mind that I've got nothing to do. It's another day. Individuals have been telling me they don't know whether it's a Wednesday or it's a Sunday or whether it's a Saturday or a Tuesday. People, the whole week has gone upside down. So a structure to the day is very, very important. And that structure actually means basic things like making sure, you can wake up and say, okay, for the first thing, I'm going to wake up, I'm going to have a shower, I'm going to have a breakfast, I'm going to read a newspaper, I'm going to go on my mobile, I'm going to watch a film, I'm going to go into the garden. You may have a hobby and you may want to go and read a book. So it's basically structuring your day, making sure that you keep the mind busy. As they say, an idle mind is a devil's workshop. So what you don't want to do is you don't want to spend the whole day with an idle mind. That doesn't mean that the person throughout the day has some kind of activities they do. You have to balance out between work, rest, and play. But it's just readjusting from the work, rest, or play from the work-life balance that we had only a few weeks ago to where we are now, where we are mostly at home, for majority of individuals, apart from healthcare workers, where we still have to go to work. But it's maintaining that structure during the day where one has to maintain that. Now, the worry here is for individuals, especially those, it's for difference. Those who have a business, who have to run a shop, have to be out there, taxi drivers, etc., who just can't go out there. Again, it's a very difficult situation because the worry of the unknown, again, in relation to the finances, bringing money home, etc., what's going to happen with my job. These are all factors where, individuals will feel anxious. Again, it's an opportunity, and it's easy for me to say, but, it's an opportunity for individuals to do things, which are not done before. For example, taking up any hobbies, doing online courses, etc. So doing very basics. Now, throughout the day, individuals will feel anxious. They will feel distressed. They will feel stressed out. And that especially with all the social media that we have. And there's a lot of information overload at the moment. And I would strongly urge, and most of it is fake, by the way. Almost 95% of it is fake. So news consumption needs to be limited. Because when they switch on the TV, when they bring their mobiles to the fore, when they go onto internet or WhatsApp or Facebook or any kind of social media, there's going to be a lot of information overload. So we have to be very choosy that when we go on social media, and going on social media is a way of communication, a way of maintaining that contact. We have to reinvent that slightly as to what we want to use it for. I mean, I've sort of got myself out of a few WhatsApp groups because it was just non-stop information. You just have to be sensible and take certain steps to do that. The other thing is exercise, and I know it's been touched on already. Exercise is really, really important. Dr. Samia Latif has already touched on, one of the government's guidelines is you're allowed to go out and exercise. You don't have to go out if you don't want to. Use the garden, use the home, use that as part of your structure, and maintain that on a day-to-day basis. It keeps the body churning, as we say. If you keep the body churning, if you keep the exercise going, your body does release natural painkillers, analgesics like endorphins, if you like, and that gives a feel-good factor. So for a short while, it does make the individual feel better. When you do feel better, or when you have a slightly better or more of a positive mind than a negative one, that's good for your immunity as well. Because a constant negative mind will impact, and this is evidence-based, this is scientifically proven, that a constant negative mind will have an impact on your immunity. So, everything is connected. The mind and the body is connected to one another. A lot of people talk about meditation, whether that meditation means religious prayers or any other form of meditation, whatever helps individuals, maintain that. So it's basically doing or restructuring things that we normally do, but it's being more conscious. So these are more, not only the preventative measures, but also, I suppose, on a day-to-day basis to make sure this is like the treatment plan at this current time. If you feel that your anxiety or distress is getting worse and you're finding it difficult, basic exercises like deep breathing exercises, muscle relaxation exercises. There's a lot of information on the internet in relation to that. You know, these are very basic and may sound very simple, but they are extremely effective, extremely effective. And these are some of the baselines for a lot of therapeutic interventions as well. But obviously, if they are really bad, you know, again, get in contact with your general practitioner. If it's really, you know, difficult, where people are definitely finding it difficult, if they're having problems with their sleep, if they're finding it really difficult to relax during the day, because what would happen is that if it's constant and it becomes chronic, it won't just have an impact on the individual, it will also have the impact on the household. And a different discussion altogether. We're already aware of the how in the increased domestic violence and domestic, you know, these you know, almost more than 22%, how much this has been an impact, and you know, it may have been something that may be going on from before, but for many individuals, it's a form of frustration. It's a form. It's, you know, it's a do you know, partake in domestic violence out of anger, outbursts, frustration, etc. So coming back to the mental health element to it, there's preventative measures, which also is managing. Managing means treating on a day-to-day basis, and this may be without medication requirement.
So Shahid, oh, fantastic, Shahid. I think you've covered not only symptoms, but, you know, who to go to if you're in problem. The one question I do have is that, you know, sometimes a lot of us can't pick up the signs. Is there anything you could tell us or tell parents or people who are listening, or just a guidance as to, you know, what are the signs that, you know, because sometimes people just go quiet and they don't know, you know, and you don't know how to judge it. So is there anything, Shahid Bhai, that you could tell us which would give us, at least give family members an indication that maybe somebody's struggling in the family?
Yeah, I mean, you've just mentioned one, Asif Bhai, and that is withdrawal, social withdrawal. People may become more quiet than they usually are. So that may be a sign. The self-esteem may be an issue. People, maybe their self-esteem may be slightly lower than it usually is. If they normally work from home or do certain things in the house, and they are losing interest in doing them, or how they used to do them previously, only a few weeks ago, the performance in that way, you know, it's reduced. Anger outbursts is a sign. Frustration, agitation. So these are very basic things. Obviously, it's very individualized, because some people, different people have different personalities. So any shift away from the norm of an individual personality, because people are introverts, they're extroverts. Some people, you know, don't like talking about things just as part of their personality. You know, that won't change. But looking at other things like anger outbursts, or more frustration, or withdrawal, or not interacting at all. These are very basic things. But obviously, if it goes to the next level, then there are different kind of symptoms. And then we start talking about more, when we start talking about a disorder, like starting to experience an anxiety disorder or a panic attack, or, you know, in those you can experience physical symptoms as well, like palpitations, or tightness in the chest or the throat, difficulty breathing, and more shakes and sweats at times as well. So these are more panic and anxiety related. With more dysphoric symptoms, that is with low mood, etc., that may start impacting on your sleep, that might start impacting on your appetite, it may start impacting on your confidence and self-esteem. So these are very basic early signs of if things are starting to slowly but gradually move toward across a spectrum from mild to more severity, if you like.
Dr. Shahid, that has been extremely informative. Now, would you like to put a last, like the other two doctors have done, any advice that is, you know, you've been giving us a lot of good advice, but anything that's specific that, you know, you give to all your patients, could you give our panel, our participants, that advice?
Yeah. Yeah, I suppose it's just highlighting the fact and just stamping in, I suppose, that please look after your mental health. That's really, really important. And one of the best ways of doing that is being conscious of your thoughts. There is a process in mental health terms or therapeutic terms that we call mindfulness. A lot of people may have heard of it, but it's a very powerful tool to use. And that is being conscious of your thoughts. If you are conscious of your thoughts, you are halfway there. So I would urge everybody, along with your physical health, also be conscious of your mental health. And the way of doing that is be conscious of the thoughts that are developing. That can fix 50% of the problem if we are conscious, and can take away, you know, some negative thoughts. So mindfulness, conscious thoughts, that's the take-home message at the moment. That's what I would like to highlight.
Thank you for that. You know, we've got about 5-10 minutes left, and we've got many questions that have come through in the meantime. So if you don't mind, can I go start from the top and direct the questions to each one of you? You know, individually, which questions go to them. So if I can just start off quickly, the first question is, what is going to be, and this is to Dr. Latif, Samia, what is going to be the impact of COVID-19 to the already underfunded and strained mental health services?
I think this question is for Dr. Shahid. Yep.
I'd like go for it. Sorry about that.
Sorry. Can you repeat the question again, please, Asif?
What is going to be the impact of COVID-19 to the already underfunded and strained mental health services?
Okay. Now, the good news is that, you know, resources are being redeployed. Now, due to the unprecedentedness of this whole scenario, the whole state that we're in, services are not closing down. Obviously, we have to remember also doctors, nurses, psychologists, occupational therapists, etc. You know, have had to take time off as well because of isolation or quarantine, etc. But what's happened in that situation is that we've redeployed some of the services. Now, what we have to look at more acute services and not acute services, regular appointments, non-regular appointments. So anyone out there who is suffering from or has been suffering from any mental condition or is under community mental health services, I would like to reassure them that services are not closing down. There's been some redeployment. You may not see the normal psychiatrist that you see. You may not see the usual nurse, community psychiatrist, but services are still there. And I think the NHS's mental health services in the NHS are doing a fantastic job. And my understanding, I can talk for the trust that I work in and also surrounding trust because we do talk to one another, is that mental health services, we are stretched, but we are redeploying and we're putting a lot of our staff and resources at the front line to make sure that people, if they do experience crisis, that it is addressed and catered for.
Thank you, Shahid Bhai. Next question is, again, this one is to Samia. How long will the COVID-19 last, and is there a chance of it flaring up with the easing of social distancing?
Right. It's very hard to predict how long this is going to last. We've had some initial modeling done by scientists and experts over the country, and I think the earliest we're going to see it tail off is we're talking early summer. It will be very hard to give anyone a precise date. It depends on how well we maintain the isolation now for it to sort of for it to go away, and the risk about it reflaring now, coronavirus, COVID-19 is now part of the flora and fauna out there. It's going to be there. It's probably going to be there every year now, just like we have the flu viruses that we have every year, and they sort of change. But the pandemic as we know it, the important thing is to bring this pandemic to end the pandemic, and thereafter we are developing vaccines for it. Hopefully that will prevent it, especially in those who need the vaccine the most. But when we do exit from our isolation and lockdown, there is going to be a phased exit. It's not going to be, you're going to wake up one day and everything's back to normal. So it'll be a phased approach, and the government is taking all the evidence into accord before they come up with the advice, and we're learning from other countries as well who've sort of peaked before we still haven't peaked in the UK.
Okay, and one more quick question to you, Samia, is that how important are the masks for protection?
Right. Yeah, I've seen a couple of questions already about masks and whether this is now spread in the air and everything. We, at this moment in time, the evidence suggests that masks should be worn by those who come in direct contact with patients. So your frontline workers, your NHS staff who are in contact with patients, and especially if they're performing any procedures where there's going to be a risk of droplets in the air. For the general public at the moment, the evidence is not out there for us to wear masks unless you are in an occupation that exposes you to patients' droplets. For the general public, we do not yet have enough evidence to suggest the use of face masks in the public. I know different countries are doing different things, but in the UK, the current advice is only for healthcare workers and frontline workers.
Okay, thank you. Thank you, Samia. One question, Dr. Iqbal, for yourself. It's a little bit long, so I'm just going to read this. What advice would the panel give to relatives who have a family member admitted into hospital with positive COVID-19 tests and are totally removed from any verbal, physical, or phone contact with their loved ones, especially when admitted to ICU? There are many examples of total exclusion of close family from patients.
That's a really difficult question to answer. In fact, I sent someone into hospital today. I sent a 27-year-old young woman with very clear symptoms of coronavirus. And I know what I should have said, which is we are told to tell people to say goodbye before they go in. But I didn't want to think this for her. I didn't want to believe it. And so I didn't say it. But that is generally the advice that is being given to people. Say goodbye before you go into hospital.
Oh my God.
That's the terrifying reality of it. And the separation, unfortunately, is necessary because the disease is so contagious that it could pass to the family, and because the health service, the hospital staff are so stretched that they can't make it possible for you to see your loved one. It's just too hard to discuss. It's just heartbreaking.
So, Dr. Iqbal, I mean, there is no solution to that question except that, look, you have to allow the process to take over. Am I right to say that?
Sadly, yes. And it's a terrible, terrible thing that's happening, that people cannot say goodbye to their loved ones, that people are dying without their family around them.
So one more question to you, Dr. Iqbal. There's been mixed messages regarding how the virus is spread. Initially, we were told, sorry, I've lost it. Initially, we were told that it's not airborne, but now there's speculation that it is airborne. So face masks will help in the spread of the virus. Can you please confirm its mode of transfer?
Oh, it's very much airborne. It's droplet spread, and some of that will be directly. So you breathe at someone and transmit it that way, or you'll breathe onto a surface which they will touch, just as Dr. Latif discussed earlier. About the face masks, it is, as Dr. Latif has touched on, it's different policies in different countries. Some of the thinking now is that if you wear a face mask yourself to go out in public, you're not protecting yourself, you're protecting the other people around you for any droplets that you may be putting out. So, I mean, again, it's changing. In other countries, they've decided, yes, everyone should wear a face mask. We haven't done that here yet. It may well change. Everything is just developing so quickly, and there's been so many advances as we go along, as we learn more about this illness.
One more quick question to you, Dr. Iqbal, is the use and the benefits of vitamin D3.
Right.
Does it help in boosting immunity, especially in the BAME people and people who have high melanomin but usually have low vitamin D?
Well, generally, if you live in the northern hemisphere where we don't get as much sun and you are dark skinned, you tend to have low vitamin D levels. One of the things that's been found from people that have succumbed to coronavirus is that I think it was cases in Italy, but they had low vitamin D levels. So on the basis of that, the advice is that this isn't official advice, by the way. This is sort of like doctors talking amongst each other and saying, oh, I think we should take vitamin D. Are you taking vitamin D? So I think a lot of people have started taking vitamin D, but we don't know conclusively yet whether or not it is a factor. So
Okay.
try it if you want, but we don't know for sure whether it will protect you.
Any of the other panel members want to say anything about immunity or about
I'll just come in there. Yeah, totally. I agree with what Dr. Iqbal has said. The other thing is, before in the UK, we have a very scientific methodology by which advice is sort of given and guidance is developed. and you normally, for something, if you want to test something, you've got a hypothesis, you've got an idea, you want to test it, you have to undertake lots of rigorous scientific studies and trials before something can conclusively be said. So I totally get what Dr. Iqbal is saying, that doctors are talking amongst doctors that, look, vitamin D may be of benefit, whereas our government and Public Health England will only and only come out with guidance when they have solid evidence that it works. And I noticed someone has asked a question about black seeds, kalonji, and whether it's got enough hydrochloroquine in it, and whether as Muslims we should be taking it. All I can say is that there are many recommended foods in Islam, like honey is supposed to be very good, and black seed and olive oil and dates and figs, so they're all beneficial and they're all part of the sunnah of our Prophet. So I would say, as part of the sunnah, yes, take them. However, scientifically, I can't conclusively say that there is any evidence yet. But if you think, as part of the sunnah, then yes, do take it. But you should be taking it all the time, not just during coronavirus.
And one more question before you leave, or before I relieve you, Samia, is here's the question: if I am correct, the main test used by the NHS staff is PCR. How accurate is this, or are these false positive perhaps because the test is non-specific to COVID and can also test influenza and other respiratory viruses? I'm concerned that everyone with general flu, like upper respiratory tract systems, are or could be being recorded as COVID-19.
All right, so I think I get the question. So yes, it is a PCR test. So what the PCR test does is it detects for the DNA of the virus in the body, and it is specific to coronavirus, to COVID-19. When we send swabs in, and when we recommend people to be swabbed for coronavirus, we also at the same time request the referring clinician to do a separate swab for the usual viral screen. And Dr. Iqbal will know that covers your flus and your other respiratory syncytial viruses and your other viruses. So this is a separate test from the flu test, and the PCR will detect DNA. The PCR also detects DNA, which could mean that you've had the infection, the virus is dead, but the DNA still exists. There's still bits of the DNA, so you might still get a positive test even though you have recovered from the symptoms. And it may take a while. We've seen in some people, it's taking a while to actually clear the remnants of the virus from your body. They're coming up with another test as well, which will test whether you've developed immunity. So this one just tests if you've got the virus, and the second test that's being developed is to see whether you've developed immunity. But the flu virus test is separate from the COVID virus test. So I hope that answers.
Thank you, Samia. Dr. Iqbal, one question directly to you. Besides immune boosting foods such as fruits and vegetables, any key vitamin supplements would you suggest that one should top up during Ramadan to help the immune system?
Well, hopefully, I think at most times we don't actually need multivitamins. We don't need supplements. If you have a healthy diet during Ramadan, as the rest of the year, you don't really need supplements. So no, I wouldn't. Just eat healthily, eat lots of fruit and veg, and make sure you're drinking plenty of water, stay hydrated. Other than that, I don't think we need anything else.
Okay, one quick question, which I forgot which one of you raised this, but it says, as Muslims, we follow the Quran and the Hadith. On the Hadith regarding kalonji, which I think Samia just mentioned, would the panel advise us to use kalonji if initial symptoms of COVID-19 occur?
Right. Dr. Iqbal can also come in. Basically, if you've got the symptoms, you've got to, you can take paracetamol is what we recommend to take your fever off. You need lots of rest. People do have lots of fatigue-like symptoms, so rest, lots and lots of fluid, keep your home well ventilated, have a good healthy diet, and that's it. I will not suggest Kalonji as a treatment. However, I've already mentioned it is part of the sunnah, so perhaps it's something you should be doing anyway, following the sunnah, and if you want to have some Kalonji seeds. But I cannot categorically say that, oh, don't do anything and just take Kalonji and that's going to cure your illness. You've got to do all this, take all the steps that Dr. Iqbal has referred to. Do you would you agree with that, Tia?
Yes, absolutely, I would.
And Dr. Shahid, just a quick question to you in reference with the same thing. Obviously, you know, does this have effect on people who've got mental health issues? And would this be dangerous for them to use these different kinds, like they say in Queen, you know, and obviously the vitamins are okay, but then there's prophylaxis treatment and so on and so forth.
I think one thing we need to be conscious of, I mean, as far as medication is concerned, both Samia and Tia have both highlighted the guidelines and what should be done, and that's a very sensible approach. I think one of the things to be conscious of is that people who have pre-existing conditions, buying over the counter, whether it's medication, etc., just be a little bit conscious that there's no adverse reactions between the two medications. So that's something just to be conscious of. It's always good to seek guidance before taking something you know nothing about. When it comes to multivitamins, obviously a natural diet is always better than taking artificial supplements. I would go back again and say what I said before, is that in order to boost your immune system, apart from the exercise, apart from the diet, keep a healthy mind. A healthy mind is very important. And we know for a fact, and there's been studies done on individuals with various illnesses, including cancer, which, you know, people have been diagnosed with cancer, and some of the survival rates which have been predicted have been thrown out of the window just because people have been able to maintain their mental health or mental state positively for ongoing, you know, on an ongoing basis. So I couldn't stress it enough that make sure in order to build that immunity, keep the mental health positive and healthy.
Thank you, Shahid bhai. And one final question, just a quick short answer from each of you to this last question. How should people go about caring for their general health? Can we still see the GP?
I guess that one's for me.
That's for you. That's for you.
Generally, you can't see your GP. We're dealing with most things by telephone, and it's been surprising how much we can deal with quite well over the telephone. We're doing some video consults as well. But if people need to be seen, I mean, I saw people today. So if people need to be seen, they are still being seen. You just have to bear with us because this is a very difficult time, and we have had a lot to deal with and a lot of changes to make to our practice. But if you are unwell, you must seek help.
Dr. Iqbal, one quick question. Somebody's asked, what about Sana Maki, herbal leaves?
I'm sorry?
As a supplement.
What was the...
It's called Sana Maki, Sanamaki.
I'm sorry, I haven't heard of this.
I haven't heard of it either.
Fine, so whoever's asking about this, don't use it.
Asif, could I just add one more thing about people who are at home and who want to seek help? As Tia said, you know, if you need to be seen, you will be seen. The NHS will, your primary care and your GP will see you. However, they've had to prioritize the coronavirus situation. The NHS website is a really good resource, and we do direct a lot of people there. So, and talk to NHS 111. But the NHS website is really good, and it'll give you some sort of, it'll signpost you to certain conditions, and if you have this, do this. And the NHS 111. But if you're really unwell and you know you are unwell, then please, you know, call 111, or if you're terribly unwell, then call 999. And a person themselves knows when that's the case.
So, Dr. Samia, Dr. Iqbal, and Dr. Shahid Latif, thank you very much for giving us your time and your wisdom. I think what I have taken from this is, you know, keep the social distancing going for protective measures, use handkerchiefs when you're coughing and sneezing. As for Dr. Iqbal, vitamins, wash your hands on a regular basis. And watch out for signs of you know, people within your family or home while we are stuck in this pandemic, to keep an eye on them, so that if you see signs of you know, either not talking or going into depression or whatever it is, that's the right time to contact the doctors. I hope that maybe a couple of weeks down the road, all three of you can spare us time again, and we can do one more of these. Can I make that request? And are you okay? Yeah.
Sure. Yes. Yeah.
We'll be a little smarter in a couple of weeks' time. We'll have more information. I want to thank all the participants for taking the time to listen to us and sending in all the questions. And pray for all of those people that we've lost. Pray for the ones who hopefully will get better in hospital. And inshallah, see you soon. Allah.
Thank you.
Thank you.
Okay.